Acknowledging that a current food safety surveillance system is passive was Minister of Health Dr. Frank Anthony, who during the launch of a 2-day training initiative in integrated foodborne disease surveillance and outbreak investigation and tourism and health information system facilitated by the Caribbean Public Health Agency, insisted that a more proactive methodology is needed to effectively respond to infectious diseases.
Where we wait on the data to come to us, then we take some amount of time to fill up the forms that we have to fill up, and then we send it to somebody who take another set of time before they put together a report. It's not working to the optimum. And what we're seeking here to do is to train everybody from the various agencies to make sure that we can respond optimally to any threats that we find, wherever we find them in Guyana.
He explained that the new system will carefully look at the different risk factors for persons contracting foodborne diseases, which encompasses bacteria and viruses.
So if you have too many pesticides in the food, if you have other matters that get into the food that are not viral or microbial in nature, but can also affect the quality of the food. And so that's another aspect that sometimes we overlook, and maybe that's something that we also would have to think about.
The training the minister advanced is in preparation for the major shift slated for the local healthcare system. He noted that work has already begun for the establishment of a health information system that allows practitioners to access the medical history of any person seeking attention at the local facilities.
When we finish that design phase, which we're hoping would take a couple months, what we'll then do is to make sure that we can buy the hardware and software and roll that out, first of all, into our hospitals, and then later into the health centers and so forth. But even if we cover all the hospitals, then we'll be able to get a lot more real-time data.
Some 13 members from the Caribbean Public Health Agency will provide training and support to local practitioners throughout this week. Foodborne illness is caused by consuming contaminated foods or beverages. Common symptoms of foodborne illness are diarrhea and or vomiting, typically lasting 1 to 7 days. Other symptoms might include abdominal cramps, nausea, fever, joint and back aches, and fatigue. Temika Rodney reporting for the HG News.